Essential workers have been front and center in a pandemic that's taken life after life. But nearly a year in, the laws and regulations that are supposed to protect them often don't.
In this News 3 investigation, Naomi Cole shares the story of one Beloit restaurant worker's death in a COVID-19 outbreak and the plight of a workforce that too often is left unprotected.
The one man who didn't deserve any of this.
His friends called him Yoda.
Get the shirt off his back to help you and never want anything in return. He was like the most kind-hearted person you'd ever meet.
His name was James Fisher. James was the assistant manager at Palermo's Pizza in Beloit and had worked there all his adult life until he tried to leave last year. His sister Christina says owner Peter Gabriel talked him into coming back. On November 22nd, Christina's husband found James dead. He had tested positive for COVID-19 during an outbreak at the restaurant.
And everybody could tell he was sick, sweating, pale, and he still had him in there working.
We talked to two current employees about the outbreak.
That's when the big outburst of the COVID started going around.
We're concealing their voices to protect their jobs. Lisa Steffens used to work there. She quit in August because she says she was told to finish her shift through a fever and stomach sickness.
It didn't matter what the symptoms were. You were expected to do your job, period.
He said, that person that comes and tells me they got the COVID, they're just fired.
Employees testing positive did quarantine, but all three employees we talked to say working while sick was the norm, including one who got sick but didn't get tested during the outbreak.
I had like a sore throat, runny nose, a cough, and a fever of 101, 102. And I would tell Peter that, and he still yet wanted me to come in because they were short-staffed.
Before Yoda got tested, coworkers say everyone knew he was sick.
When Yoda started getting sick, he was tail sick. He still had him working.
We can't confirm where James got the virus. We do know that his sister and coworkers say he was working 6-day weeks and long hours. He had few friends outside of work. The owner responded to a request to explain what happened. He said he greatly missed Yoda, but characterized the allegations as hurtful and incorrect. 3 people called the Rock County Health Department during the course of the outbreak, saying employees were working while sick. The department opened 2 critical complaint investigations. One near the beginning of the outbreak, another 3 weeks later. In both cases, it was 2 or 3 days before department staff called the owner. Both times, Peter told health officials he was following safety protocols. In the first conversation, he denied having anyone working while sick. In a follow-up call, reports don't say if he addressed that same allegation again, but he did tell officials again that he was following all of their safety guidance. After both calls, public health then marked both complaints closed. Over email, an environmental health investigator said these can be he said, she said situations, and that they did talk to employees as part of contact tracing for the outbreak investigation. Rock County says we followed our protocols. Wisconsin law gives local health officers broad powers to enforce health directives like quarantine orders. DHS guidance tells them they can't explicitly close a business. There's other options, though, like citations. But in this case, no citations were issued.
In your opinion, based on your experience, your practice, is the breakdown in these kinds of situations more a lack of protections or a lack of enforcement?
And oftentimes employers feel emboldened because they know that OSHA isn't going to come and shut them down, and their local health departments aren't going to come in and shut them down. So they bully their employees into staying and working in unsafe environments.
State and federal laws require safe working environments without discrimination or retaliation. But throughout the pandemic, worker protections have been rarely enforced. Working while sick is a public health issue. Being asked or expected to work while sick, that's also a workplace safety issue. But according to DHS guidance, there's no requirement that public health officers report workplace safety concerns to OSHA.
People being made to work while sick. Does that fall under OSHA jurisdiction?
It does fall under OSHA's.
No one reported Palermo's. Even if they had, OSHA enforcement of COVID regulations has been scant at best.
Once administrative agencies such as OSHA get involved, do they suffer any type of consequence more than a slap on the wrist? Oftentimes, unfortunately, no.
In Wisconsin, there's been just 4 COVID-19 related OSHA citations.
In who's paying the price, it is the workers.
While Republicans in the Wisconsin legislature are focusing on making sure businesses can't be sued, and the state is currently tied by court order not to release the names associated with outbreaks, laws protecting employees, they're often enforced slowly at best.
So employees are very much left to the delays that are built into a bureaucratic system.
An ROC United survey of more than 4,000 restaurant workers in 2010 found the vast majority of them don't have paid sick leave and often work while sick. During the pandemic, ROC United CEO says he's heard the same story again and again.
There is a link between public safety and economic justice. We shouldn't put the workers to make a hard choice between saving lives and feeding their families.
For restaurants following strict protocols, the Wisconsin Restaurant Association says COVID-19 spread is low. In Wisconsin, from March through November, they account for about 4% of cases linked to outbreaks, according to a newly published CDC report.
When you are operating a restaurant, it is really important to be doing everything you can to protect yourself, protect your staff, and protect your customers.
But when that doesn't happen, workers often have to decide between their job and their health.
Workers should be put out in front and center, especially when we call them essential workers.
Having to choose between a job and their health oftentimes leads to fatal consequences.
James died at home. He had no health insurance. The medical examiner told his sister he looked like he had a heart condition that was exacerbated by the virus. For him,
Why was Yoda's death allowed to happen?
and for themselves, his coworkers want justice.
Nobody wants to listen. Nobody wants to do anything until it's after the fact.
And in an ongoing threat of restaurant workers missing out on key protections, they're not yet on any list to get a vaccine in Wisconsin. That's despite federal recommendations that they be in Phase 1B. But for James and a grieving family, all that is far too late. For News 3 Investigates, I'm Naomi Coles.